I was born in Mexico, but I was raised in LA.
I'm from Mexico, Guadalajara.
I'm original from Oaxaca, Mexico.
I'm from Mexico, from Acapulco.
When I was a little boy, and I go to school and Monday to Friday, and after finish the school, I going to help to my dad in the field. And so after finish the school, my father said, you have to come in the time, because when you don't come in time, you're gonna be in big trouble. And so I very strict to me when a little child. So I learned to my father, I have to very discipline and organize my life, because when I old, my dad, he liked to be a good man.
My children they mean everything to me. I mean, I work hard for them, and I don't just try to give them everything, but I try to teach them that you always have to give your best when you're working.
My father died when I was little. Everybody was little when my father died. So.
My dad got sick and stayed in bed for almost 9 years. So, and in Mexico, we don't have like here, people go to their houses and help you like here, like we would do here, like go and help them up with the shower, or the nurse go to their house and help the family. No, it's so different in Mexico. So my dad got sick, and then after he passed away, I just started like, oh, I'm gonna start help others.
I was always, an advocate about patients' rights and all of that. And when I got to this job, that's one of the things that I love so much, because it was like you could sit down and get to meet the patient's family. You go into their home, you get to know their atmosphere, where they come from, sometimes their history, their background. And that, to me, that's just something that's very rewarding to me.
Each patient, I try to do my best, because every day is different, and I try to do it the same to each patient, to keep it nice, clean, dignity, passion.
I think it's a good idea. We had somebody invent hospice, because I know they help a lot of. I mean, everybody needs help when they go through to the stage. So if it's not hospice, who's gonna do?
You always see your parents doing for themselves or your family members, and all of a sudden they just can't, and it's just, full circle where it's just like, okay, I'm not used to this. I don't know what to do, but we go in there and we teach them. We teach them when they're in the point of their life, when they're like, I can't do this, I can't do this, and we come in there and we help them out, and I've seen it many, many times.
Most of the patients, they said, oh, I just want all this done. I'm just so tired. So I just like trying to not hear that, because I don't want they die. Yeah, I'm just say, oh yeah, it's okay, and then we just start talking about the family, and they just forget everything. Yeah, trying to remember their family. Yeah, we just change conversation when the patients say that.
This is like a teamwork. It's a teamwork. It's good support for each family when the patient is close, when the patient is passed. It's like, it's there. Hospice Care of the West is there to help to the family.
Oh, it's so awesome. All the nurses, every which one of them, they're so nice. They're always willing to teach you, to help you. They never say, well, you know what, this is your job, you do it. No. If they see a situation where you need help, they don't even ask. They just step in and they help you, from cleaning somebody to helping them get out of bed, and all of them, they help out.
You can feel like it's a family around here.
I had this one patient who was really tall. He was like 6 feet tall. And he came in and he's like, I was new. He's like, what are you gonna do to me, you little thing? He said, you're not gonna be able to do anything. And I said, all right, well, why don't you finish eating your lunch? And then you let me take care of what my job is. And he's like, all right. And I did feel intimidated when he told me that. But then when I was done with him, his daughter-in-law asked him if he wanted something. And he's like, well, why don't you ask the boss? Because she's the boss. She knows what she's doing.
I remember one patient, Mary Lasher, and always when I go there, she told me, what do you do? Why do you wake me in the middle of the night? I said, no, Mary, it's almost 6:10, 6 o'clock in the morning. Oh, yeah, you're right. So she's always choking me. And I miss this patient because always she's trying to choking to me early in the morning. I learned from her. She told me always, Marcelo, you starting to save your money when you retire? Yes, Mary, but you have to be sure because you know now everything is expensive. But think about 40 years from now later, it's getting more double and expensive. Oh yes, Mary, I learned you for everything you told me. I will remember you all the time.
You get attached to people, and then before you know it, you have to say goodbye to them. It affects me, but at the same time, it's very rewarding. I know that I get paid what I do, but this is what I was supposed to do. You know, I've never loved my jobs as much as I love this job.
I call the nurse and I say, how is Mrs. So, and I say, and she told me, oh, they just called me. She is go. And she told me, can you go clean her up? Say, okay, I'm here close to her house, so I wanna go. So I went there. So she's still warm. She's still warm, but it's that moments. I think I feel strong in that moments to be helping patients like that.
But when my patient passed out, I feel like a part of my family is going because I feel touch the patient. And when the Mary Lashley passed out, I feel something in my body. You know, well, it's time to go, and nothing we can do. So that's what I come to the life, enjoy the life, and celebrate the life when you can. When you're not, there has to be somebody help to us when I old. So when the patient passed out, I feel sad and try to not involve in my body, in my mental, but I try to, you know, this is end. Thank you for you, enjoy you and me, my life, and the lives continue all the time. The life is done for each person when pass out, but the life is going all the time. Yes.